Patients and families are Stoughton Hospital's #1 priority. To provide trusted health information to our patients and community, we present Stoughton Hospital Health Talk with Melanie Cole.
You know you're supposed to get 7 to 9 hours of sleep at night, but sometimes that just doesn't happen. How does lack of sleep affect your health? My guest today is Dr. Jacalyn Nelson. She specializes in sleep medicine and is the director of the Stoughton Hospital Sleep Disorders Center. Welcome to the show, Dr. Nelson. What are some of the health hazards of not getting a good quality night's sleep?
There has been a lot of research done on that very topic in the past 10 years or so, and findings suggest that poor sleep can lead to weight gain and even developing diabetes.
So we have seen this direct link more and more in the media between lack of sleep and obesity. Why, in your theory or your opinion, are we seeing this connection so strongly?
We're seeing it because a lot of us have very poor sleep habits.
So what is the link between obesity? Is there a hormone involved? Is there something in our physiology that tells us if we're not getting a good night's sleep that contributes? Or is it because when we're so tired, maybe we eat the wrong things?
Well, that's definitely true that we eat the wrong things, and the reason why it does lead back to hormones. There are a couple of gut hormones. There's one which controls satiety or feeling full, and the other which controls hunger. And their ratios tend to get flipped in sleep deprivation, which leads you to wanting to eat more carbohydrates and grab for those sugary snacks, and which, of course, leads to weight gain.
So in this world, this today world, Dr. Nelson, everybody is so busy, from our teenagers all the way on up. We're on our electronic devices and our smartphones, and we're so busy at night before we go to sleep. What do you want people to do about getting a good night's sleep, sleep hygiene? What should we be doing before we go to bed every night?
Disconnect. I think in a word that would be one of the things that may help a lot of people the most. And what I mean by disconnect is disconnect from those electronic devices. We've heard a lot of hype in the media in the past couple of years about the blue light that emanates from the screens we're typically on, which include your smartphones, tablets, PCs, and even the TV these days. And that blue light is very stimulating and makes it harder for our bodies to help wind down and prepare for sleep. So in the hour or so before sleep, I recommend no electronics. Reading, engaging in quiet activities is fine, but nothing strenuous, and certainly you don't want to be eating a heavy meal before you go to bed, but occasionally some people require a little snack right before bed, and that's fine. And again, disconnecting.
So if somebody is not getting an adequate amount of sleep, and before we talk about what those symptoms would be, what is an adequate amount of sleep? Start with our teenagers, kind of work the way up.
Sure. Teenagers need probably anywhere from 8 to 10 hours of sleep per night. And, of course, that's not happening in our society with the way homework is structured, and especially since a lot of homework is due on the computer. They're often on their computers late at night. And because our school start times are not allowing them to get the adequate sleep they need.
So then, as people need 8 to 10 hours and they're not getting them, what are some of the symptoms that you're noticing? When should someone see a doctor about sleep deprivation? Okay.
So what I just said when I said 8 to 10 hours refers to adolescents. You know, adults need probably anywhere from 7 to 9 hours, as you said in your introduction. The American Academy of Sleep Medicine recently made a guideline suggesting that what the adult needs to remain healthy is at least 7 hours of sleep. However, we know from population studies that most people need somewhere between 7.5 to 8.5 hours of sleep to feel rested. So that's a different question, it's a different question than what you need to remain healthy. But I just want to make those distinctions. And so coming back to what people can do to get a good night's sleep, again, like I said, disconnect. Think about caffeine. Caffeine is a stimulant and can keep people awake. Some people can't tolerate caffeine at all. Some people need to restrict it to perhaps only before lunch. You have to kind of take a look at how you respond to caffeine. And obviously nicotine is another stimulant that can have the same effect, as it can worsen your sleep with a lot of arousals, and then sometimes the withdrawal process from it can also cause a lot of arousals. And that leads me to alcohol. You want to avoid alcohol within 4 to 6 hours of bedtime. Again, alcohol may help you fall asleep, but study after study after study have shown that it doesn't keep you asleep. In fact, it causes a lot of arousals, and it may be the same mechanism that you're kind of withdrawing from that alcohol.
And Dr. Nelson, if your cognitive abilities are affected and you haven't gotten that good night's sleep and you come to see a doctor, what can they expect from a sleep disorder center? People are afraid of a sleep study they hear. How do they get a good night's sleep at a sleep disorder center or in a sleep study? So speak about what treatments you can look at for sleep deprivation.
Again, focus on establishing a good sleep routine and going to bed at the same time, even on the weekends and vacations. Avoid taking naps during the day, as that can impact your ability to fall asleep at night. Maintain a regular schedule for meals, chores, and other activities. Our bodies really like routine. And then another very common problem I encounter in my practice is that people have a difficult time shutting off their minds. They're worrying, going through the day, and so sometimes you need to set aside a time in which to do that. Another helpful practice is mindfulness meditation, which can kind of allow you to help disconnect from the day. And
so then what about something like a sleep study? What does that do for someone? And can you actually get a good night's sleep at a sleep study?
You can. Now, is it going to be exactly the same as a night at home? Maybe, maybe not. You know, there are lots of wires. Some people don't sleep as well in a new environment, whether it's a hotel room or a sleep study. But in general, we certainly get enough information to know what's going on or not going on. And I think it actually is quite rare that we ever have to repeat a study because we didn't get the information we needed. Now, the major reason to do a sleep study would have more to do with breathing difficulties at night more than insomnia or sleep deprivation.
So then, in the last few minutes, give your best advice about sleep deprivation, the importance of a good quality night's sleep, and what people can do at home. And I'd like you to even touch on, Dr. Nelson, some of the complementary things people are now trying to get a good night's sleep, melatonin, or you see all these ads for the medications online and in the media. Just kind of wrap it up for us and touch on those things too.
Okay. So in order to improve your sleep, again, I've already talked about establishing good routines, and you also need to make sure that you have a nice, comfortable sleeping environment that's not too bright or too noisy, too hot, too cold. In terms of using sleep aids like melatonin, in general, I ask people to try to avoid them. The over-the-counter ones tend to be antihistamines of one sort or another, and sometimes those aren't always safe, especially as you get older. And then the other popular one that you mentioned is melatonin, which can be helpful sometimes, but occasionally people are taking too much or they're taking it at the wrong time. And in general, I see not being able to get a good night's sleep as being a symptom of another underlying problem. So my job as a sleep physician is to play detective and try to figure out what that is, if that makes sense.
And tell us about your team at the Stoughton Sleep Disorder Center.
My team includes a PA, Alyssa Tess, who has just joined us and is excellent. In addition to Ms. Tess, we have a nurse, and then we have our technical staff actually performing the sleep studies at night, which consists of sleep technologists who are trained to perform sleep studies.
That's such great information and so important. Thank you so much for being with us today, Dr. Nelson. You're listening to Stoughton Hospital Health Talk, and for more information, you can go to stoughtonhospital.com. That's stoughtonhospital.com. This is Melanie Cole. Thanks so much for listening.